Welcome to our channel Medicine World. In this episode, we will discuss on anti-ulcerant pantoprazole, therapeutic class, proton pump inhibitor. Let's start. Keep watching. Pantoprazole is indicated in peptic ulcer disease, gastroesophageal reflux disease GERD, ulcer induced by nonsteroidal anti-inflammatory drug, in combination with antibiotics. Pantoprazole is indicated in eradication of Helicobacter pylori. It is also indicated in Zollinger-Ellison syndrome. Now we will discuss about how pantoprazole work. Pantoprazole is a proton pump inhibitor that suppresses the final step in gastric acid production by covalently binding to the hydrogen potassium ATPase enzyme at the surface of the gastric parietal cell. This effect leads to inhibition of both basal and stimulated gastric acid secretion, irrespective of the stimulus, that persists longer than 24 hours. Now we will know about how proton pump inhibitor inhibits hydrogen potassium ATPase. The gastric hydrogen potassium ATPase mediates the transport of potassium ions in the extracellular fluid into the cell, while intracellular hydrogen ions are simultaneously pumped out of the cell against a high concentration gradient to complete ion transport and gastric acid secretion. Hydrogen potassium ATPase activity is stimulated by inflammatory and other factors by the bacterium Helicobacter pylori, leading to excessive gastric acid secretion and GERD. This is the mechanism targeted by PPI therapy. Dosage of pantoprazole should be maintained as, for benign gastric ulcer, 40 mg daily in the morning for 4 weeks, continued for further 4 weeks, if not fully healed. For gastroesophageal reflux disease, 20 to 40 mg daily in the morning for 4 weeks, continued for further 4 weeks, if not fully healed. Maintenance dose is 20 mg daily, which may be increased to 40 mg daily. For duodenal ulcer, 40 mg daily in the morning for 2 weeks, continued for further 2 weeks if not fully healed. For duodenal ulcer associated with Helicobacter pylori, pantoprazole is recommended at a dose of 40 mg, twice daily in association with antimicrobial agents as detailed as amoxicillin 1 gram and clarithromycin 500 mg, both twice daily for 1 week, or clarithromycin 250 mg and metronidazole 400 mg, both twice daily for 1 week. For prophylaxis of NSAID-associated gastric or duodenal ulcer, 20 mg daily for those require long-term NSAID treatment. For Zollinger-Ellison syndrome, initially 80 mg once daily adjusted, according to response, elderly maximum 40 mg daily, daily doses above 80 mg given in 2 divided doses. In case of intravenous injection, for duodenal ulcer and gastric ulcer, 40 mg once daily for 7 to 10 days. For gastroesophageal reflux disease, associated with a history of erosive esophagitis, 40 mg once daily for 7 to 10 days. For prevention of rebleeding in peptic ulcer, intravenous 80 mg, followed by 8 mg per hour infusion for 72 hours. For prophylaxis of acid aspiration, 80 mg intravenous every 12 hours for 24 hours, followed by 40 mg every 12 hours. For long-term management of Zollinger-Ellison syndrome and other pathological hypersecretory conditions, 80 mg intravenous every 12 hours, may increase to 80 mg every 8 hours if needed, may titrate to higher doses, depending on acid output. Pantoprazole will be administered before meal, in empty stomach as possible. In case of taking pantoprazole, some reported side effects can occur: headache and diarrhea, abdominal pain, flatulence, rash, insomnia. Pantoprazole is US FDA Pregnancy Category B drug. Pantoprazole has been shown to be excreted in human milk, so a decision should be made whether to discontinue nursing or to discontinue the drug, taking into account the benefit of the drug to the mother. Pantoprazole is contraindicated in patients with known hypersensitivity to any of the components of the formulation. Patients should be advised against splitting, chewing, or crushing pantoprazole tablets. Prolonged use of pantoprazole may result in reduced absorption of vitamin B12, or potentially elevate the risk of osteoporosis-related conditions. Due to vitamin B12 absorption hampered by pantoprazole, infertility, hypothyroidism, depression, cognitive decline, energy loss and numbness can be occurred. Bangladeshi brand of pantoprazole are Pantonix, tablet 20 mg, Incepta Pharma, Pantonix, tablet 40 mg, Incepta Pharma, Pantobex, tablet 20 mg, Bigzimco Pharma, Pantid, tablet 20 mg, Opsinine Pharma, Trupin, tablet 20 mg, Square Pharma, Pansec, tablet 20 mg, Drug International, Panoral, tablet 20 mg, SKF Pharma, Pantonix, 4 injection 40 mg per vial, Incepta Pharma. Innovator brand, Protonix, Wyeth Pharma, subsidiary of Pfizer, Germany. If you like our video, please subscribe our channel Medicine World, and push the bell icon for getting more videos regarding medicine. Thanks for watching, stay with us.